Coming up next is Nutrego from the Czech Republic, represented by Ondřej Gojiš. Ondřej, you have 20 minutes. As suggested before, we suggest that you divide your slot into 10 minutes presentation and 10 minutes Q&A. I will let you know before the time slot ends, like 3 minutes before. And for you guys, if you like to connect with Ondřej, just hit us in the chat and we will make the connection happen. So the floor is yours, Ondřej. Thank you.
Okay, so good morning, everybody. I hope you can hear me. Let me introduce myself. My name is Ondřej Gojiš, and I am representing basically two companies coming from Czech Republic. One is Ardea Pharma, producing parenteral products, including infusions, local anesthetics, and also some solutions for the ICU and cardiosurgery departments. And the second part of my presentation will be about the enteral nutrition, basically a new company named Nutrego. So at the beginning, let me introduce the Ardea Pharma company. It is the Ardea Pharma has been established in 1996 in the south part of Czech Republic. It's a classical producer of injection, infusions, parenteral solutions, and other ions solutions. Just the general information, this company is a holder of all the international and local certificate. The most important information for you should be the GMP and ISO. And let's focus on the basics groups of the products of our portfolio. I was thinking how to introduce our portfolio the easiest way, and I put it into the couple groups. So the basic ones, we are producers of solutions affecting the acid-base balance. These solutions are mainly focused for the intensive care units, metabolic departments, internal medicine departments, and also the geriatric clinics. The most commonly used is a sodium bicarbonate solution or the arginine hydrochloride solutions. Speaking of these arginine hydrochloride solutions, also the pediatrics professional using it quite commonly, as on the units of neonatology, they are focusing on the acid-basic balance, and this arginine hydrochloride solution is commonly used. The second big group is quite commonly used different concentration of the glucose. As you should know, generally glucose is very commonly in Europe used in 5%, 10%, maybe 20%. However, in Central Europe or in our region, our professionals quite commonly use 40% of the concentration of the glucose. This 40% is also not very, I would say, not many producers can do it for the healthcare. Another group is the commonly used concentrates for the solution for the infusions: sodium chloride, potassium chloride, sodium phosphate, potassium phosphate. These solutions, as I mentioned before, are used for the metabolic departments and also departments where the parenteral patients are carried out, as these patients are quite commonly need some support and support of the parenteral nutrition. And other parts, we do have two products in a local anesthetics. We are our glass are 80 mils, 200 mils, 250 mils, and commonly used is mostly the trimethine hydrochloride. Yes, these products are made for the big departments of plastic surgery, big departments of dermatology. Sometimes neurologists do use it. So we do not have these 10 mils vials, but we have 80 mils and 200 mils glasses. About the osmotic diuresis, for again the group of our products, speaking of the diuresis and the diuretic products, we have only one mannitol solution, but again we have a mannitol in a different concentrations. So I think we have a 5, 10% and 20% mannitol. Again, it's commonly used in the intensive care units. And then we have a group of the cardioplegic solutions. These Thomas's cardioplegic solution is commonly used in Central Europe in the departments of cardiosurgery. These solutions are used when the operator is working on the heart operation, open heart operations. So again, there are no that many companies producing this type of the product. And then we, of course, the groups before were quite kind of specials, and of course, but in our portfolio we do have as well the classical, I would say, routine used solutions, such as physiological solutions, ringers lactate. We do have a Hartmann's and different solutions of electrolytes. We are quite happy that this year, in the beginning of this year, it was, I think, March 2020, our group was quite successful to finish a fully registration of a new product, which is potassium dihydrogen phosphate. This product is doesn't, I don't know about any products in this group in Europe, and this product is very kind of special, speaking of for patients who are fully parenteral on the parenteral feedings. These patients, they have a very commonly have a depletion of phosphates, and this depletion is associated with the potassium depletions provided with hypokalemia. If you sometimes will talk with the I would say doctors, internal medicine doctors, or professionals dealing with these patients, it is quite an issue. It is quite an issue to how to manage these depletions of phosphates and potassium, how to treat them. And our product, this potassium hydrogen phosphate, is tailored for these patients, and it works very well. So this was a brief communication about the Ardea Pharma and the parenteral products. And now let me introduce the second part of our group, and it is the company named Nutrego. The Nutrego is focusing on the clinical enteral nutrition. We do have a sipping food, and we do have a gavage, or if you want, a tube feedings. The company was established in 2013 in Opočno in Czech Republic, and basically our technical background and producer background is in Bohemilk in Opočno, where historically has been made enteral nutrition, baby food, and high quality dairy products products. So as I was mentioning, this baby food and the high quality protein products has been made here since 1985. Of course, the factory is a holder of international food certificate and the ISO. And now let me introduce the first part of our enteral products. We do have a sipping food. We do have it in 200 mils. We do have it in 330 mils. And all of our products are in 6 flavors. The most commonly used is Nutrego Forte. Generally speaking, this is a high protein and high energy sipping food for the patient in a post-operative period. Also, the oncological patients who are dealing with the cachexia, oncological cachexia, and basically this Nutrego Forte is the most commonly used sipping in our region. Then we do have a special sipping for diabetics. Diabetics where there are low sugars and containing resoluble fiber. We do have a Nutrego Renal, where the Nutrego Renal is focused for the patients with the chronic kidney disease and in the stage of pre-dialysis. So basically, these patients are treated chronically and they are followed by a nephrologist, and basically, they do have a depletions of the proteins in their food. Then we do have a renal HP. Renal HP is a product focused on the patients on the second side of the nephrological care. Speaking of the dialysis, again, it's a high protein product. I will introduce later on. We do have also the fruity, is a juicy style sipping. We do have Nutrego fiber, which is focused on the patients with the GIT problem, and it has a high concentration of the fiber. And we do have, as well as the others company in Europe, we do have a Nutrego cream, which is focused basically for the elderly patients. And basically, it is not a liquid, but it has density like I would say like a yogurt or something. Again, we do have a couple flavors, so our elderly and geriatric patients, they really do like this Nutrego creme. Speaking of, as I mentioned before, speaking of the patients who are on dialysis or chronic kidney disease stage 5, it is quite brand new product. It has a low phosphor, low potassium, low sodium. It has quite high protein, speaking of 10 grams per 100 ml. And basically, as I mentioned before, it is focused for the patients in the nephrologic or dialysis care units. And now just a couple of words about the Gavage nutrition or tube feeding. Our products are in 500 ml version or 1 liter or 1000 ml version. All of them, they do have 2 flavors, and these are basically focused on the patients who are in the hospital, in the ICU, when they do have a tube, or for the patients who are basically have a PEG, so it's a percutaneous gastrectomy. So the oncological patients or patients after the operations in the area of esophagus or GIT area. Again, we do have a couple of products for renal patients, diabetic patients of high fiber tube feeding. And last year we managed the tube feeding for the ICU. Its name is Nutrego Intense HP. This tube feeding has been made according the guidelines of ESPEN, European Society for Enteral and Parenteral Nutrition. It has a high protein. It has 35% energy of coming from the protein. There is a low isocaloric concentration of the ions, and also can be used in the sarcopenic obesity patients. This intense HP is really focused on these early nutrition, especially when on the ICU you have a patient on the parenteral nutrition, and you have to keep his GIT keep working. If not, the patient could be in trouble. Basically, that's it from me. I would love to have any questions from you, and thank you for the attention.
Thank you, Andre, for the fascinating presentation. What a complex issue. So now the floor is yours for your question. We have 5 minutes till time slot ends. So
thank you, Andre. This is Yuri. Just a quick one, actually, for everybody on the line. I've been privileged to stay closer to Andre's companies, and I have to say kudos to you, Andre, and your team for the speed of the development of the products. It's great. I mean, from idea to regulatory and getting to the markets, and actually it looks state of the art. So kudos, and looking forward for further expansion of corporations.
Thank you.
Hello, Mr. Goish. I am Lenka Shibestova from Aspironix, and I would like to ask you if you has already some reference center in the hospital, in the ICU in Czech Republic?
Yes, thank you for the questions. As I mentioned before, that some products are brand new. So basically, at the moment, we are in, let's say, 5 or 6 big hospitals in Czech Republic, and the references are, I would say, quite good. There are no big issues. So I would say, yeah, we have a full registration. Our products is working pretty well. And now I am speaking about the enteral nutrition, which are quite fresh, right? Speaking of the parenteral products, they are in the hospitals in Czech and Slovak Republic for more over, let's say, 15 years, right? So the enteral nutrition is quite fresh, and the references we do have, and we are in the hospitals, and we are also in the social services for the elderly people.
Okay, thank you very much. And the main competitor is for you Fresenius or B. Braun?
Oh, it's a good question. The biggest in a enteral nutrition, the biggest competitor is of course Nutricia, Fresenius, and Nestle. And speaking of the parenteral products, we are competing with the B. Braun and Fresenius. Yeah.
Thank you very much.
Yeah, welcome.
So we'll see. Thank you.
All right, thank you.
Hello, Andre. Can you hear me?
Hello. Yeah.
Hi. I'd like to ask a question. One of our markets is Libya, where the registration laws are a bit different from Europe. Basically, in this market, it's only the manufacturing site which needs to be registered as opposed to the individual products. So my question is this, I mean, in terms of the injectables you covered in the first section of your presentation, are these products manufactured in one site or in a number of sites? I'm asking this question because it's actually the site which needs to be registered.
You mean a site?
Manufacturing site.
Manufacturing sites. Well, we have they are made in one factory in south of Czech Republic, and in this factory there are 2-3 departments where these products are made, right? So, is it? Did I answer your question?
So basically, all the lines of your injectables are manufactured in one location. Is that correct? In one factory?
In one factory. Yeah.
That's an advantage, in fact. Thank you very much, Andre. Thank you.
You're welcome. Yeah.
okay, if there are no other questions.
Hi, just me. Hi, Andre. Nice to.
Hello, Jonathan. Hello.
Get a face to a name now. We've been in communication over the last few months. You know, we've been involved in this in this business, and I can say that it's got fantastic potential. Certainly, all 3, parenteral, enteral, and the SIP feeds, have a great place in all markets. There's no doubt about that. Now, our next step. Well, first of all, for us, what's important is, you know, flexibility, ability to supply, presentation. Actually, this presentation now has taken me to the next step, which is what we will need to do ourselves, and that's to understand exactly, indication for each of your specific product lines, because you've got a number of product lines which are quite specific and away from the normal standard tender requirements, so require obviously development. So for us, that would be the next step, definitely identifying each of your products, identifying exactly the indication and who the targets are, which you've brought to light in this presentation. Thank you.
Yeah, just may I just a couple words about Jonathan. Thank you for your comments, and I just forget one more thing. As we are basically let's say a normal company in Central Europe, and we are quite free in a sense of development or in a sense of basically tailoring products for you. Speaking of, let's say in enteral nutrition, for example, I have to say I have some partners in Poland, and the habits of enteral nutrition are totally different comparing to Czech Republic, right? So we are happy and we are free that, and thanks God we are free that our technological department is free to development products tailoring for your country, as if I'm clear. So for example, if you will be interested in a high calorie, let's say low proteins, etc., and the amount of bottles will be this and that, we can think about it, and we are free. We are a small and flexible company, and we can basically do enteral nutrition in private label for you if you are interested, right?
Great.
But of course, it is a question of exclusivity or dealing with your company in your region, etc., etc. But thanks God, we are free, and we are doing what we think is best for you and for us. Actually, that's our advantage, that we are a small and flexible company, and our technological department is very, very flexible.
Great. Thank you.
Thank you. Thank you.
Okay, thank you guys for the great discussion. Thank you, Andre, for presenting. And once again, just repeating, if you want to connect us to Andre, just hit us in the chat and we will make the connection happen. So thank you guys. The next pitch coming up is Biodicin from Italy, represented by Ariana Di Segna, and we will meet again in 8 minutes. So thank you and see you soon.
Thank you. Bye.
Not Andre.